I'm Sherry Weinberg, also known as Sarah Weinberg. Hi, Sarah. My mother thought up the nickname Sherry. Go figure. And I'm the president of the Western Washington chapter of Physicians for National Health Program. And I welcome you all to our December monthly meeting. So since our screens all look a little different, each one of us gets to name somebody else to introduce themselves. So I'll pick David McClanahan.
Okay, I'm the chapter co-founder along with you, Foy, there back in 2006, and I've been the coordinator ever since then. And was on the national board for 4 years, but then now I'm an advisor to PNHP National.
Hi, I'm Hugh Foy. I just retired 16 months ago after a great career at the U as a general surgeon. The last 27 years at Harborview, and before that I was David's junior partner and mentee at the last vestiges of public health care in Seattle, known as Public Health Hospital in PacMed, and now retired.
Yeah, Dana Iorio. I'm the current vice president of PNHP Western Washington. Practiced alongside Hugh at Harborview for many years. Not actually alongside, but at Harborview. Retired, I think, a few months before you did, Hugh. And just in time to miss the drama of this pandemic and all the ins and outs. And the venerable George Martin.
Okay. I'm Grandpa George. I'm going to celebrate my 94th birthday in not too long. Yeah. I'm a professor of pathology. It's now the department fused again after, I don't know, 50, 60 years with the lab medicine. So it's now the Department of Lab Medicine and Pathology, and it's going very well. And I'm emeritus but active. I still got a grant from the NIH, and I'm a member of the board of PNHPWW, and I hope to continue. Chris Swang.
Yeah, I'm a primary care general internist at the UW, and sorry I haven't made a meeting in a few months, but I'm glad to be back joining you guys. Sarah, since she's right below me on my Zoom screen here.
Heiner, I am a very recently retired general internist, 11-year or 10-year member of PNHP, originally from Chicago, but practiced in Nevada for 30 years and moved up here to retire. Just finished my career at Jefferson Healthcare.
So you're across the sound, right?
Yeah, I'm in Port Townsend. Who's next? Roxanne.
Hi, well, I feel a little bit out of place. I have a doctorate, but it's in education. So I'm a member of Whole Washington, and I've been attending your meetings off and on for, probably over a year. I was a Bernie Sanders delegate 2016 and a state delegate 2020.
My name is Mark Prue, and I'm also a member of Whole Washington. Live in Des Moines and split my time between Des Moines and Bellingham. And mostly try to get my nose into other organizations besides Whole Washington who are advocating for universal health care, because no one organization has a monopoly on all the proper ideas.
I'm your general all-purpose lefty radical that has no real experience with the medical field, except I was in the operating room last night, and so I'm a little bit cured of my diseases, I'd have to say. The faces are of the top 7 countries handling the virus, and the faces of the top countries in the world whose faces are all male that are not handling it well.
Yep, all the females are handling it well.
Yeah, isn't that fascinating? The top 7 anyway.
Hello, everyone. My name is Andre, and I haven't been to one of these meetings before. My background is in tech, so I graduated from the University of Washington in information science, and until recently was working at Microsoft, but decided to leave, and so now I'm kind of trying to see what it's like to spend more time and attention on activism, and I'm a volunteer with Whole Washington, also delegated for Bernie Sanders in 2020, both state and national. And so I'm excited to meet all you folks and get to know your organization a bit more. I'm a big fan of Physicians for a National Health Program. The organization has done some great work over the years and is worthy of a lot of respect. So I'm happy to be here and to meet you all and to also do my part to represent whole Washington.
Hi, my name is Jen Perkins. I'm a family doc up here in Alaska, actually. So I work at South Central Foundation with Alaska Native American Indian population. I guess our big news today is we just got a big shipment of vaccines. So we are on the front lines of that conversation, which has been chaotic and interesting. Longtime single payer supporter. We did start relatively recently a PNHP chapter up here. A lot of conversations recently about, thinking about what our wonderful colleagues in Washington are doing, especially around Whole Health Washington, and wondering if there would be any, ideas as far as like regional connections, recognizing we're pretty small and far away from everyone else.
Well, welcome from Alaska. That's exciting.
Hi, I'm Rich LeGue. I'm a longtime single payer supporter, mostly active down in Oregon through the 90s and early 2000s. And I'm a member of PNHP Healthcare for All Washington. I think I've at least contributed to Whole Washington. Glad to be here.
Anyway, I think we're just going to talk about two things today. First is healthcare working group that just had its 9th and last meeting, and Sherry's been a member of that working group that's supposed to figure out and make recommendations to the legislation about how universal healthcare can be, available to every resident of Washington State. So take it from there, Sherry. And then I'll talk about the Healthcare as a Human Right Washington, which just had its general meeting yesterday, and I'll bring you up to date on what they've been up to.
Well, the Universal Healthcare Work Group was started thanks to legislation that passed in 2019, and it got organized and people appointed by the summer of 2019, and then it had its first meeting in September of 2019 when I happened to be out of the country, so I missed that one. We were lucky in that our lobbyist, this by our, I mean Healthcare for All Washington's lobbyist, was able to get several of us named to the work group, which is really quite an accomplishment. The work group has been kind of structured by the Healthcare Authority has responsibility for doing it. And they hired an outfit called Health Management Associates, and they chose their Portland office mainly because Health Management Associates had worked with the Oregon single payer folks in trying to evaluate options in Oregon. So it seemed like a natural to ask them to come and help us in Washington evaluate the different options. So they pretty quickly structured it into 3 possible models. And Model A is a single payer, state-run, tax-supported system that would be run by the Healthcare Authority and taxed to get a hold of the money that's out there in the form of employer contributions plus what people have been paying for premiums and out of pocket, but to find a way to tax that to support it, and also to get the federal funds bundled together somehow and brought into the state. That's Model A. Model B is essentially the same thing, except that instead of the Healthcare Authority running it directly, that they would contract with private insurers to run it. And that's a lot like, I agree with you, Sarah. That's a lot like the Healthy Options program that came out in the early 1990s, where instead of seeing Medicaid patients and billing DSHS directly, you started having to belong to different insurance companies that had Medicaid contracts. So that's what option B was. Option C was basically a fill in the holes. In other words, working with the ACA and trying to do patches to make it more complete and include some of the populations that are excluded in the ACA. All right, so they've talked a lot about this. And of course, the work group has representatives from the insurance industry and from large hospitals, you know, and for the Washington State Hospital Association, as well as the Association of Washington Businesses. So it's the work group has a broad political spectrum, as well as some people thrown in to provide appropriate decoration. A guy named Mohammed, who is a Somali representative of that community in Federal Way, as well as two people who work with Indian tribes, one who works with and one who is actually a member of a tribe. So there's some of that. They managed to do pretty well, given that it's hard to find people to do this. All right, so that's the long-winded version of where we got to. So what is happening? We had our last meeting. Supposedly it should be all done and we've got a final report. Well, the final report didn't quite accomplish what we wanted at that last meeting. And there are two major things left. One is we did poll at that meeting each of the 37 members of the work group, and each had an opportunity to select a model or abstain and to explain briefly why they made their choice. Since 7 members of the work group are state officials, most of them may well abstain. So it's hard to know exactly how it will come out. And they did not announce the results of the poll, but they did say that they would put it at least in an appendix of the final report. And they're reworking the report based on some of our concerns. And one of our concerns was that the report that they had written was essentially a mishmash that just said, well, we discussed these options and there was no clear consensus, but here are some things you might consider if you want to move towards a state universal insurance, which is basically a recipe for having a fat report land on a shelf gathering dust. So there was considerable sentiment, not just me, but believe me, I was noisy, that if we wanted to get anywhere, we would have to come up with a firm recommendation, and better yet, to lobby for it, to try to sell it to the legislature. So we'll see how the report gets rewritten. This final meeting was a week ago today, and they are supposed to get the final draft of the final report out by Friday, the 18th, giving us until Monday, the 21st to reply to it. So we'll see. We just don't know. Our informal polling suggests that we're going to have a plurality, if not an actual majority, in favor of Model A. That said, Model A is the kind of thing that would take 3 or 4 years to kind of set up the groundwork for it and actually get it running. So it doesn't cost very much right at the beginning, which is good because the budget is a mess, as you all know right now. But the other thing about Model A is it doesn't do anything about anybody right away, whereas Model C has the possibility of putting in some patches, like let's cover all of the undocumented, that kind of thing. And so what we should recommend is let's move towards Model A. And meanwhile, let's use some patches to try to help people who are hurting badly right now in the interim. So if I were writing the report, that is what it would say. But I am not writing the report, and we will see. Although there are others who feel the same as I do. I'm not a lone voice in the wilderness here on this work group. So I view it hopefully, and let's watch for some kind of news coverage when it actually comes out. It's due to be released by December 31st. It was supposed to be done, of course, by November 13th, but November 15th, excuse me. But a little old thing known as the coronavirus interfered with the progress in the middle of the year.
Sherry, I thought you showed remarkable restraint. I actually put up my Christmas tree and all my Christmas decorations and listened to the whole 3 hours. It was coming from another state. I've been in Nevada for 30 years, and I think I told you guys at the last meeting, which was my first, that I actually set up and ran a free clinic for a nonprofit called Volunteers in Medicine while I was down there prior to Obamacare. And that's when I joined PNHP and got involved in. It's just, you just keep seeing the same thing over and over. People, it was quite obvious listening to some of the speakers at that meeting, at that task force last week that Sherry was very eloquent at, that they really don't get that these insurance companies are not out there to take care of people. They are out there to make a profit, even the nonprofit ones. And there just were some comments that were remarkably naive, even for a task force, from some very, very well-meaning, good people. And it just reminds me as an internist of watching what the private insurers have done to the Medicare Advantage plans, and just basically contorted and twisted them over the last decade or more until they become just another cash cow, masquerading as a goodwill thing for people over 65.
I'd like to add one thing to that too. I was one of the people who gave testimony, and I believe it was 100% of the people who gave testimony spoke to option A.
Yes.
And I have to apologize. I have to leave to attend another meeting.
Yeah, that was an observation I was going to make, that
Thanks for coming.
99% of people were
Thank you.
testifying for option A, and they would only allow 20 minutes before the meeting started. Of course, they couldn't go forever. They had more than 40 people signed up for most of those. The two main objections that the staff there said that, well, is this feasible given the power structure and the effect it would have on the hospitals and the politicians and the doctors who would not be in favor of, presumably not be in favor of option A. And I think the second one was that they were concerned that it might not be feasible because of cost, but they hadn't really looked at the cost. And there's plenty of information out there that a single payer plan getting rid of private insurance would save a whole lot of money.
That was brought up and addressed at this last meeting, that there was no particular reason to call this not feasible. That there are two kinds of feasibility. One is a single payer program, something that could actually work to provide coverage and pay for a system. And the answer is the rest of the world is doing that, and it's working very nicely for them. So it is definitely feasible structurally. The second kind of feasibility is talking about politics, and that is what has been hanging up the US. But part of it is simply calling it not feasible helps to make it not feasible politically, and it's time to stop that.
Well, and people have short memories. I mean, we're just recycling discussions that were held in the 90s about stuff like this. And so, yeah, I mean, people discuss these feasibility options as if no one's ever talked about them before. And by kicking the can down the road, it's just made it 100-fold worse. But I do think that the other issue that is a real positive in COVID times is what's happening to the base in healthcare. I can't speak for surgery or pediatrics, but I know in internal medicine and family practice, at the ground level, which I just left 6 weeks ago, they cannot possibly pile any more administrative costs on to practices at a time when there's such a shortage of doctors. It will be the final straw that breaks the camel's back as far as manpower for decades to come.
There's another study that just came out about looking attitudes of medical students, current medical students, and 70% of them would be happy with a government single program.
My students that I had we had rural health students up here in Port Townsend, and they are very, very they just can't understand why this hasn't already happened. So a couple of months of rotation through a practice dealing with health insurance companies, and they start to get the general the drift of it.
Yeah, the other thing about that study, though, David, is I read it, was that most of them were more in favor of a public option, which we know is not, it just adds another layer of bureaucracy and cost and administration difficulties to the current system. So, and I said that we just need to do a little more educating of our students, medical students, and nursing students, of course, that a public option is really not a good alternative.
I think that's true, and they need to, people say public option, and there's huge number of variations on what that means. So it has to be spelled out to those students what that would mean. I think what was 80% of them said they would be happy with a public option, 70% basically a single payer program.
Well, my only question, which has largely been answered, but I supplied both on camera and subsequent comment, and I'm just curious, does anybody actually read that stuff?
I do.
Okay, I mean, I was just curious. I mean, I figured, it's not going to help if I don't do it, but I was just curious if it might actually have any visibility.
It does. We get it emailed in a Excel form to read all of the written or email submitted testimony, and I have read it.
Okay.
And I believe at least the fellow progressives are all reading it. I can't speak for the poor guy who is hired by the Association of Health Plans to represent their point of view. And here he is as a person, and who knows what his personal beliefs are. But he's being paid to say no. Same thing for the guy who's there for the Association of Washington Business and the guy who's there for the Washington State Hospital Association. I don't know how much they do. And there are 4 legislators on there, one of whom has barely attended, the Republican senator. And so who knows how much of it he's reading, rather than just saying it doesn't matter, I'm going to vote no, whatever no means here. So you don't know, but it is important, and it is being relayed to all of us.
Okay, well, that's good. I mean, hey, I'm retired. I'm sitting around watching my hair grow, so I got plenty of time to shoot off my mouth.
Getting back to the young people, they made a big difference even in the General American Medical Association. Yeah. They were for years and years adamantly against single payer. And now they're turned to sort of neutral and reconsidering it because of the pressure of young physicians and medical students. So I still think that's the future for us, to push hard.
The students are in 2 forms. There's the young doctors or student chapter or part of the AMA, but there's also an American Medical Student Association that
Yes.
I don't think is under the umbrella of the AMA. And the latter, the American Medical Student Association, is all in favor of single payer.
That's right.
I think a really proactive thing that if you have students, and I stay in touch with my students from here and a couple from down in Nevada, is I've actually offered to buy them a PNHP membership for a year just to lure them in. And I've actually had one take me up on it, which is kind of neat.
I think students are free. Students are free.
Yeah, but you know, you make the offer and they're like, oh, okay.
The PNHP SNAP chapters across the country organized a demonstration out in front of the last AMA meeting and got them to withdraw from this horrible consortium that was basically of insurance companies against single payer. And so the AMA withdrew from that.
That was right as the ACP position paper came out last January, I think.
Yeah, yeah.
Chris, you being in the fray right now, what's your perception of the medical students' attitude?
Well, it's hard to say. So we have our SNAP chapter, and I think, you know, John not being here anymore is hard because he was really helping lead a lot of that. And some of the other students graduated. Some of them emailed me like a month ago about trying to revive some of the SNAP, you know, the student chapter work. So I would love if, you know, bring back some of you all to be speakers, but it sounds like there's very little actual curriculum, like not just what we teach them when they, you know, rotate with us, right? But it doesn't sound like there's a whole lot of curriculum still at the UW Med School about single payer. I don't know if, Hugh, that's your experience too from teaching there.
Well, I'm a couple years out of it, but there was Medicine, Health, and Society was the course that where this would be pigeonholed. And there's been a lot of turmoil amongst the student body on social and political issues over the last 3-4 years. I mean, it's really been a firestorm that has been hard to, control is not the right word, but at least get your arms around. The students have been very vocal, really started with the 2016 election, and then every 2 years it's just escalated. Ray Maestas, you know, is the Associate Dean for Student Affairs, and Ray's really had her hands full. But I think it would be great to start a conversation with those students. The problem with UW Medical School, even pre-COVID, is that it's such a diverse and dispersed group. And they don't spend any significant period of time in any one place. I mean, there's only, 100 Seattle-based students, and the rest receive their education in the peripheral campuses out in Whammyland. And the political spectrum there is phenomenal. So it would be great, Chris, and we could talk some more just to have some, you know, maybe some neutral topics, if you will, and see if we can generate some interest. I've got a talk I put together for the paramedics on the history of pandemics, and I'd be happy to do that for the students, just to kind of foment a little bit of interest and enthusiasm in general.
I wonder if there'd be a place to do, for those of us who are physicians or in healthcare professions of any kind, just each of us individually do a little outreach or research into our educational institutions, whether school or training, find out what they're doing, how it feeds into, as you said, Chris, the huge societal things that the students are very engaged in now, as they should be, and see if there's a place to combine that with some mentoring as an alum.
Well, we just
go ahead.
Just got contact. Was it through you, George, with 5 first-year medical students at UW who said they're single payer supporters and want to, you know, reestablish that link with our chapter. And so we invited them to our board meeting on Sunday. So
yeah, one of them, Joe, I can't immediately remember her last name, Chris. I talked to her about the importance of extending our reach out to the new medical school at Washington State University and to start a SNAP chapter there. And she was quite enthusiastic about that. I think we should do that. Mm-hmm.
We're having our next Thursday, the ACP, which, as you know, is the internal medicine. Those are your physicians. Is the Internal Medicine Society is having I'm on their healthcare policy and ethics subcommittee, and I'm just getting the lay of the land there too.
Where is it going to meet? Where?
It's a Zoom, and it's next Thursday. And they asked me to report back to them about the work group situation and what happened there. So I will give them the input on the 3 models. And the ACP has not come out in favor of single payer. As you know, their big policy paper that they published last January was in favor of some type of national healthcare program, but they have not committed to single payer yet. That said, there's a tremendous amount of distrust of anything to do with the insurance companies having anything to do with rolling anything out. So they're kind of right now looking at, and Chris, I don't know how active you are in ACP here, but I got the impression it's a fairly conservative subgroup of a fairly active national ACP chapter. And I'll have a better handle on that probably after next week's meeting.
I dropped in on that last month's meeting for the first time. No, mostly I've been working with SGIM, and for ACP, I mostly just show up clinically. But yeah, I was a little discouraged by the last meeting. It seemed like they want to just talk about like advocating for flu, wearing masks. And I'm like, we don't need ACP to do that. We have great public health here. That was my flavor. And I think Carrie Horowitz and some of them were very conservative about doing something actually progressive.
Yeah, but there are some very progressive doctors on there. I know Gary Forbes from up here is very progressive. It's just
my sense is we'd have to infiltrate and take over for them to really be more progressive. And nationally, they're more progressive. And I interpret their position as being for single payer, the national ACP. I interpret their statement.
I think the national ACP is. I just don't think it's actually in. I reread that whole thing about 2 or 3 weeks ago, and they offer it up as one of their options. And they had some. This was a year ago, pre-COVID-19. So I think right now that worm has definitely turned more towards single payer. I just think their policy and ethics committee meeting is maybe a little slow. But I spent 30 years in Las Vegas, so I'll see what I can do.
I shouldn't forget the core problem is the unlimited amounts of special interest funding for lobbyists. And that was just beautifully expressed in that episode with this wonderful California Nurses Association they got through the legislature in California 2 years in a row when Schwarzenegger was the governor, a bill for single payer, at least in California. And it was vetoed. Then Jerry Brown came. And all of a sudden, the Democrats were helping the nurses. They said, well, I'm not so sure this is a good idea. It's going to cost a lot of money. We got to think that through. You looked at where the money comes from for their reelection, and it's big pharma, healthcare. The guys who were making the leaders, they knew damn well that Schwarzenegger was going to veto it, which he did. But then Jerry Brown, maybe he won't veto it, So suddenly, all these so-called progressive Democrats who are helping the nurses, they crapped out. That's what's going on. That's the core problem.
That's it.
Yeah, we've got to fix that somehow. It's going to be very, very difficult. The whole
I think Chris is right. I think there needs to be an Aegean Stables cleaning.
Yeah.
We just need to sweep clean.
Well, Jerry Brown vetoed it when they put it to him.
I don't think he did. I think the Senate Democrats there protected him from having to veto or pass it by not passing it through the Senate.
Yeah, that's correct. It was Anthony Rendon, who was a legislator who wouldn't give it a hearing on the floor.
But there was a big press release from PNHP a year ago about this article in the Annals of Internal Medicine that the ACP had in fact endorsed single payer. I mean, I just pulled up the studies. So maybe it was just rhetoric that, according to people that are closer to it, find hollow. But I mean, PNHP blasted that out in their newsletter, and it was in the lay press as well, that the American College of Physicians had endorsed single payer.
As
no,
one
they did.
of like 2 or 3 different options.
Well, they also said a public option as a sort of bridge toward universal healthcare was okay, but I think if they hadn't done that, that came out in January. If they hadn't put that in, I'm not sure they would have gotten it through. And then, so yeah, I definitely am with PNHP, and I interpret that as they are supporting single payer. It was huge, and I was shocked they did it, quite frankly. And for SGIM, we tried several years to get them to support single payer, but we only were able to once ACP said yes. So no, I credit ACP for doing that. No, I think what Sarah and I were saying, the local ACP, Washington State, doesn't seem like they wanted to take on anything like really progressive right now. They wanted to focus on like wearing masks, get your flu shot, stuff like that, which I didn't think,
Oh, I see. So that was a local deal.
Yeah, internists are I think a lot of local internists are very, very caught up right now with just the logistics of, I just spent an hour and a half this afternoon on an excellent ACP webinar from about the COVID-19 rollout for the vaccines. I don't know, Chris, if you had time to look to see that.
No, but it was like the last meeting, they were super worried about get the second vaccine and tracking. And I'm just like, well,
really good. And I think that's a big problem with the ACP right now, is they're just so caught up with their members treating patients and dealing with the reality of that superimposed on the recent election. And that's, the support for more equity for Black Lives Matter, all the different racial and creeds and stuff coming out. And I think it's just gotten to be a little bit overwhelming for a state. I mean, you're talking to somebody who was in Nevada. Our ACP chapter was pathetic.
Right.
And
you're from Chicago, Sarah. I mean, come on.
I know.
Yeah.
A while ago.
So
is
there a
stranded in Nevada for 30 years after California and Chicago and San Francisco. And, it's just a different world out there in some of the other states. And I think part of one of the reasons that I'm pushing for this policy and ethics committee is I think this is, as we've talked about in this forum, this is a great time to take advantage. I mean, for the first time in a decade, there's some momentum here that we can't afford to lose.
Not to mention the force of necessity.
They talked about that at the vaccination thing today.
Well, just
very articulate people talking about rolling this whole vaccine thing into all of the public health implications for this, and how much better it would be if we had, more universal everything.
Well, a national infrastructure, at least for a database for tracking all this stuff, right?
Right. And funding for safety.
That's right. I my colleagues are probably tired of hearing me say this over and over again. I think the future is in preventive medicine. And to do preventive medicine, you have to have population-based epidemiology.
Right.
To do that, you have to have a single-payer national health program. And there are lots of research going on, very exciting, about the influence of perinatal environmental agents, not only on the somatic cells of the fetus, but on the tiny germline in the fetus. So you can get not only intergenerational inheritance, but transgenerational inheritance. And there's a guy at Washington State University who's been working with a common agricultural fungicide in Eastern Washington. and he gives pregnant rats this fungicide. And he's now at the 3rd or 4th generation, and they have inherited, because of epigenetic changes from this environmental parameter, a hallmark of aging. It's genomic instability. If you have genomic instability, you get a lot of more somatic mutations. You're more likely to get cancer. You die earlier, and you have a lot of age-related diseases. And so this is an enormous important aspect of public health. We can't do it here. We can't do population-based epidemiology. And things I think of in Taiwan, they have a wonderful system. They were the first to show the importance of periodontal disease in the cytokines that push inflammation systemically come from their gingivitis, and they could score who had bad periodontal disease and who was treated not very well. Who was treated well makes a difference even in Alzheimer's disease. There's an inflammatory component. So the ones that had good periodontal disease, and you can go on and on with this, and you'll save gobs of money. But they're not interested in saving gobs of money. They're interested in the stockholders and the executive salary.
Right.
I knew the guy who was a colleague of mine in interested in aging research, who became the CEO of Aetna. He was there for a few years. Do you know how much money he took home in bonuses? It was something shy of $1 billion.
Wow.
It's amazing. And the CEO who took his place, his starting base salary was $32 million. That's his starting salary, and he's going to get big bonus. And what they do is if they have a clinic or hospital that's costing them too goddamn much money because they have too many sick people, simple. You write them a letter to the CEO and say, "I'm sorry, you're out of our network."
Right.
So you don't want to insure healthy people. You don't want to insure sick people, only healthy people. And that is one reason why, depending on how you make the public option, you can make there like some public options if you put the poor guys in there. Sure. with no money and lots of illnesses. Let the goddamn public pay for them. We don't want to insure these guys. So I can imagine they would go to some forms of public options. All they care about is the bottom line for stakeholders and for executives. That's all they care.
Well, they pulled out of San Juan County. My brother-in-law lives on Lopez, and all of a sudden he got a letter saying, "You don't have any health insurance anymore."
Yeah.
And I forget which commercial insurer it was, but his only option was either Apple Health or Kaiser. And if you live on Lopez, the closest Kaiser facility, which is only an outpatient clinic, is in Everett. And then to get cardiology coverage, you had to come all the way to Seattle. So, I mean, they're horribly corrupt, but I think in a new administration, what we really need is to get a public health infrastructure reestablished, because the agenda that they kind of sloughed to Trump was dismantle the federal government because it's all bad, right? And if you read The Fifth Risk, has anybody read The Fifth Risk?
Is that the Michael Lewis book?
By Michael Lewis.
I haven't read it yet. It's on my list. I just finished Cast, though.
Yeah, you got to read The Fifth Risk. And it was all about the libertarians who control the Republican money and their agenda to dismantle the federal government. And even in an op-ed in the New York Times, Charles Koch admitted they were wrong in trying, because they found they couldn't control Trump. But that was their agenda. But The Fifth Risk is an excellent read. It's small, it's very to the point, and Michael Lewis is a phenomenal writer. But Trump had no idea what he was doing, and Chris Christie had to come in and bail him out because he had no transition. He didn't even know what a transition plan was, let alone have a plan. But they just started to dismantle department after department, just kind of choke off the federal government.
Does
Yeah,
anybody know his new CDC, the new incoming CDC director?
What was the question?
Does anybody know anything about, I can't remember the name of they just announced the new CDC director yesterday or the day before.
I don't know.
Coming
I
in.
don't know. Incidentally, the terrible tragedy is the deregulation of environmental protection generally. That's really inexcusable for healthcare. Incidentally, I made a mistake. This guy didn't take over home $1 billion. It was a $500 million. So still a lot of money, just for the record.
Oh, just a $500
$2
million.
shy of a $500 million.
Yeah, you know, a $500 million here, a $500 million there, and pretty soon we'll be talking about real money.
Yeah, that's right. Yeah. It's all about, the thing that I wonder about, I wish somebody would do research on, why is, quote, socialism a word that makes people shake with trepidation and horror? What is it? I don't get it. Why? What's the kind of history behind that?
I think
every 4 years.
I think what it has to do with is the communist government in the Soviet Union, which after all was called the Union of Soviet Socialist Republics. That's what CCC or USSR stood for. And so it grew out of socialism. And
Cold
so
War.
It's a Cold War. Yeah, it's a vestige of the Cold War.
Yeah, maybe that's the origin. Yeah, but that's a long time ago. But there must be other aspects of it.
Taken on a life of its own.
Racism was a long time ago too.
Yeah, I have there's a family I know in Norway. It's just wonderful. One of the quote socialistic bills that they have, if young couple have she's pregnant, they get both of them full salary for a whole year, and they split it. So I knew the neurosurgeon took 4 months. The male is a father of the child, and his wife took the 8 months. You could do various permutations and combinations, but it's fantastic. You both are bonding with the kids. That's great for in terms of human development, to bond with your kids. And it's socialism. There's some wonderful things that can be done, including healthcare. So it's twisted somehow.
Well, it's their information machine.
Yeah.
Run by Rupert Murdoch and all these other ultra conservative and libertarian types. I mean, I don't know if the other book that I would highly recommend is Dark Money by Jane Mayer. Jane Mayer, and if you want to read the short version, read Lewis Lapham's piece in the October 2004 Harper's, which outlines the Republican propaganda machine back in 2004. And then Jane Mayer just completely blew them out of the water with her book. That's probably one of the most important books I've ever read in my life.
Yeah, good. Yeah. It's in a way, it's scary. It's much scarier than Trump. Are the millions of people who voted for them who are so influenced by propaganda?
Right.
It's like Goebbels again in Nazi Germany. It's just very frightening that they don't understand the nature of evidence.
Right.
Of critical
I don't
thinking.
think though, as far as the mission of PNHP, I don't think you will ever break through the wall of greed in the United States to get to these people, to get them to support a change in the health, in anything to do with healthcare in the United States. I think it's got to come from the need for the services. In other words,
why the pandemic is the opportunity.
Right. The pandemic, for those of you who are general surgeons, I mean, look at what has happened. I'm 63 years old. I've been in medicine since 1978. If you had told me in 1978 what would happen to my profession as an internist, I would have said, no way. No one would put up with that, but yet we have. We knew by 1995 that internal medicine and family practice physicians and then pediatricians were going to take it in the chin because they couldn't figure out what we do in those exam rooms all day long because we don't do procedures. You
Right.
could see that train coming a mile away and you couldn't argue it. You know, I think what saved you pediatricians, and please correct me, was just the vaccines, and you know, you had that stuff, you know, but what's happened, you can't argue. I fought this in Nevada, in a state that is completely focused on greed.
Mhm.
Always has been, always will be the I got mine, good luck getting yours state. And I really think the key to getting to these people is the money, but the key is you have to do this because there's not going to be any doctors. There's not going to be any nurses. There's not going to be any clinics. There's not going to be any bodies to take warp speed operation and get those vaccines into vials and into your arms. There's not going to be any pharmacists. And it seems to me over the last 10, 15 years that that's been the only thing that gets people to pay attention.
Well, that's the unfortunate reality, isn't it?
Yeah.
That everything has been monetized. You know, there's no sense
You
of,
can't break
of
it.
common good. It's just how can I get mine?
Yeah, you cannot break it in the United States right now.
I see that as a very serious underlying problem, is our lack of a sense of community, not only a national community, but even a local community, that we just don't really feel it. I used to say, I live on Mercer Island, surrounded by Lake Washington, that, you know, if I saw a mob coming down the street, or if I saw a guy beating down the door of my neighbor's house, I would, you know, take action and go out there and chase the guy away or whatever. If I saw some people coming down the street, I would mobilize the neighbors to attack them and do something about it. If I heard there was a mob coming across the floating bridge from Seattle that was going to attack Mercer Island, I might say, well, I'm at the south end of Mercer Island. I was at the time. What do I need to worry about this? Well, maybe a little bit. And, you know, as the further away the problem is, the more of a sense of I'm not going to worry about it. And so we're missing that sense of pulling together as a community, even on a small community like Mercer Island. It's still divided into the no tax group and the community support group.
Well, I think we got to move on to the second part of the program.
You're right.
Healthcare as a human right, Washington. Spent maybe a half an hour on that.
Yep.
Well, those of you who don't know, Healthcare as a Human Right Washington was founded, I think it was like 2008 or something like that, wasn't it?
Yes.
And basically it was our idea, and we were co-founders, but it's since morphed into a fairly large organization with some political clout and so on. I'm on the steering committee of it. And there was a retreat this past month with 2 3-hour sessions with a facilitator. And basically what came out of that was healthcare as a human right needs to focus on bringing more people of color into leadership positions in the steering committee. Number one, there are a number of people of color within the organization now, but reach out and bring in others that are not involved so far. And the second thing is intentionally relate to grassroots organizations that are out there working on maybe not single payer, but social determinants of health, because these are all, intersect with each other. And we need to all move together as a web of progressive organizations and attack all these causes at once. Let me screen share here a second. And yesterday was the general meetings of Healthcare as a Human Right Washington, which happens about every 6 weeks or so. So I'll just tell you a little about what happened there. Let's see. So here's the sponsor organizations. Can you see this?
Mhm.
Yes.
So the sponsor organizations, to be a sponsor, you have to agree to give some money to the organization, some staff time, or some other sorts of material support. And I think there's, what, 30 organizations or 20 some now. And you can see there's a wide range of organizations here. And I think all but 2 of them were at the meeting yesterday. And then there's allied organizations which agree to the principles of healthcare as a human right Washington, which basically we all agree to. And there's a bunch of these organizations that, so it's a pretty good list. So yesterday, the meeting was, it was a virtual meeting, and I think 60 people showed up. It was led off by Larry Brown, who's the head of the Washington State Labor Council, who did the initial greeting and the, tribute to us being on native grounds. And then, let's see. Then basically, just skip to basically most of the meeting was about the political priorities for this coming legislative session. And there were several speakers here that represent organizations. One, Cheryl Wapsmeyer, who's Native American, Pam Dallin from North Seattle Progressives, Jim Howe, American Federation of Teachers, Washington, talked about the political context and the possibilities of things moving ahead at the state and federal levels. Emily Bryce, who's working with NOLA now, Northwest Health Law Advocates. She gave an overview of where the situation stands, and then things that the organization is going to back, including system transparency, dental therapy. Raleigh Watts from Country Doctor, executive director, talked about the community health centers as a safety net for the uninsured and immigrants. I can put this in the meeting report so you can take a little longer look at it. But basically the legislative agenda that people were going to vote on prevent cuts to healthcare and the income support programs, raise the revenue necessary to prevent these cuts, advance health equity by improving affordability and access to care. We're going to wait to see what the health care work group comes up with in the basis in their recommendation to the legislature, which Sherry made reference to. Health care system transparency to show people exactly what the cost of everything that's happening out there in the healthcare system. Medicaid postpartum, increase it to 1 year coverage for postpartum. That's going to be introduced in the legislature, and will back anything that increase immigrant health access, documented or not. And then there was, let's see, I'll skip that for a second, dental and mental health care access. And these are all, I think, some of them bills that were in the last legislative session that are going to be reintroduced. And I think this is a long session, right? So we'll have more time to look at them. When it came to a vote, everybody voted in favor of these legislative priorities, but there was some kickback on this one right here, Cascade Care subsidies. This Cascade Care right now gives money to the private insurance sector. It's part of the ACA exchange. And this is Eileen Cody's pet bill. Right now, there's no money for subsidies. So the idea is to provide subsidies for people for low income to buy, the private insurance plans. So when it came to a vote, there were a couple people that abstained from that, voting for that one. I think Sherry made a comment about, what was it?
Right. I did not vote against it, but I commented that the Cascade that subsidies for Cascade Care were barking up the wrong tree. And that it was important that people realize that these subsidies would basically send state taxpayer money directly into the pockets of insurance companies. And is that what we want to do? That's all. But I didn't want to upset by tearing things apart in terms of not supporting whatever the whole group was going to do.
Well, Healthcare for All Washington is also pretty much against Cascade Care. So we'll see what happens with that. But
well, actually, they helped support the passage of the Cascade Care bill, thanks to our lobbyist. And it was the goodwill from Eileen Cody et al. In our testifying, Healthcare for All Washington testifying in favor of that helped get the work group later. So
Right.
Kind of a quid pro quo.
Right. They twisted our arms. So I'm interested in the goals guiding overall healthcare as human right work.
Let me just finish here. The federal legislative agenda and Healthcare for All Washington also is very much in favor of working on national legislation. So basically, here's some the current national legislation is the State-Based Universal Health Care Act, which would help single-payer efforts in states by allowing states to collect federal money, such as for Medicare and the Fed's share of Medicaid. The national, of course, single-payer, HR 1384, Camilla Jayapal's bill, and Bernie Sanders, which is definitely inferior, but keep working towards those. Defend and strengthening existing programs. And then there's the Healthcare Emergency Guarantee Act, which is out there now to help prevent people, suffering from losing their insurance with the COVID situation. So those are the legislative agenda. And what were you asking, Dana?
Oh, under the goals, it says the bottom bullet point is protect what we have now. What are they referring to?
Well, any efforts to chop away the safety net, I think, is what
right.
we're talking about.
Okay.
I mean,
we have an insurance-based system now that totally leaves out a bunch of people and is inequitable, and so I hope they weren't considering that as
what
we have now.
It's kind of a reaction to the Republicans trying to end the ACA.
It's terrifying that they could even consider anywhere in the country doing that, but they will.
So anyway, this organization has some sway with representatives, good ones like Joe Wynn, who's a strong single-payer supporter from West Seattle, and Nicole Macri, who's a pretty strong single-payer supporter, as well as a bunch of others.
How strong a single-payer supporter is Derek Kilmer?
No, not.
I kind of got that impression the short time I've lived up here.
His big thing is he wants people to have access.
Someone will provide that for them.
Hey, if you have enough money, you have access.
Got it. Good to
Well,
know.
and it's also you can always go to the emergency room kind of a view of access, disregarding what's going to happen to the bill that you get from the emergency room as a result of your going there. So it's a superficial reaction that doesn't really get into the meat of the problem of why people go to the emergency room and what happens to them when they get there.
There's a lot of
I need to work on it, Sarah.
Did I say I just retired 6 weeks ago? My husband's sitting back here laughing hysterically.
Yeah, he's like got a PhD or something in astrophysics. I mean, the guy's really bright, but he's fairly conservative.
Who's that?
Kilmer?
Derek Kilmer.
Well, I think he thinks
pretty popular, so we'll have to see. But not Port Townsend's pretty blue but within reason. So we'll find out over the next year as now that they've let me out of all my little exam rooms,
Yeah.
start finding out what's going on.
Well, we've only got 2 representatives in our state that have signed on to a single payer bill, Adam Smith
And he's
Right.
mine.
and Pramila.
Well, Pramila, the author, right? Didn't she
Yes.
write?
Yeah, she's an incredible leader. Too bad she
You can
can't be
believe
president.
you can believe that Adam Smith is going to cave as soon as it becomes in his interest to do so. I mean, he knew that it wasn't going to go anywhere, so it was easy for him to sign on and bolster his progressive bona fides, and it's strictly a positioning ploy for him. His heart ain't in it.
Well, there was this petition that went around for a resolution to support Medicare Advantage plans in Congress, and I think Smith signed on to that one. Camilla didn't.
Can I ask the committee, do you have anything you'd like me to take to the ACP next week?
I mean, that's a good question. Would it help if ACP supported some of the work group work? I mean, did they get involved or not? I wasn't really paying too much attention to that.
No, I kind of got the impression, I talked to Gary Forbes about this a couple of days later, because it was, as my meeting was with you guys last month, my first subcommittee meeting with them, because I just couldn't get involved when I was working. And I got the impression that they just aren't really doing much of anything. So I think I did get an email back from Carrie, I believe is the chairman, saying she would like to hear me, as I think I said to you guys earlier, she would like some feedback from me about the state task force wrap up from the other day. But they're, like you said earlier, Chris, they're focusing, I think, a great deal on the vaccine rollout. And after listening to this thing today about how strong the anti-vax movement is positioning themselves to basically spike this whole vaccine rollout, I can see why, especially the subspecialists in medicine who are taking care of so many immunocompromised patients and stuff, are really concerned about this. So, but yeah, I think that may be something that I could do, is do a little liaisoning if nobody else is going to be doing it. Maybe that's something I can help with.
That would be really good. Who is kind of the head honcho in the ACP in our state?
Oh,
Well, there's a new governor, Chris
yeah,
Knight, who's down the hall from me.
Who is it?
Chris Knight. He's very good. He's down the hall from me.
Well, 3 or 4 years ago, the national president was from Washington, Seattle, I think. That's when they, came out in favor of single payer as one of the options they supported. So
Yeah, I guess what I'm wondering, Sherry, is, we're all in different medical societies, I suspect. I mean, is it helpful to try to get our local chapters to endorse these various either local state bills? A lot of them don't have good mechanisms. You can't propose a resolution and then vote. They're all kind of loose,
Mm-hmm.
But is that something you're looking for, or did you feel like you had enough from the task force, enough input, et cetera?
We've never really gotten there, and the various societies were not heard from as such on the task force. I'm not sure who was there. Nobody was there officially representing the Washington State Medical Association, for example.
Really?
Yeah.
Wow.
But it may have been Rod Tritko, who is from, he was an anesthesiologist in Wenatchee, and he is now retired and is living mainly in Arizona, and having to shop for his own health insurance has changed him dramatically. It used to be that at all the WSMA House of Delegates meetings, he was on one side and I was on the other. But now all of a sudden it's like, hey, this system is really crazy.
Yeah, I mean, it might be a little late, but I mean, would that have been helpful if we had gotten, King County Medical Society supports Model A, Washington State ACP supports Model A, WSMA supports Model A? Is that helpful, or does it not really matter?
I think the King County Medical Society probably would. However, there's kind of an agreement that county medical societies don't go off on their own, that they put their input into the WSMA, which then speaks on behalf of state medicine. So King County would be very reluctant to get out on a limb and do something independent.
Got it.
What
Yeah,
about
so
the professional societies like Chris mentioned? What do you think about that,
they
Sherry?
don't want to say something that national
really
doesn't.
thought much about it. I'm a member of the American Academy of Pediatrics as a retired pediatrician, and I get stuff from the Washington chapter all the time. And they seem to be very much buried in a different set of weeds and not paying any attention to overall coverage issues. And I don't have any contacts on with the current powers that be, or even with the past powers that be. I've not been particularly active in the Washington State chapter of the AAP. So
Well, wasn't Kyle Yasuda from Seattle was the national president in the American College of Pediatrics? I don't know if he still is. I know Kyle.
Oh, Kyle. Yeah. Yeah. I remember interviewing him as an applicant to medical school when I was on the committee there was a brief period of time when they allowed students to be on that committee, and I was one of them.
So Hugh, as past president of the Seattle Surgical Society, do you think there'd be any chance of getting a resolution passed by the Surgical Society? There's a bunch of progressive people in there.
A bunch, yeah. You can count them on one hand, probably.
Bring it to a vote.
Well, we could. I could bring it to our next executive board meeting, but
bring it to a vote.
Scott Helton would go for it, wouldn't he?
Well, hopefully.
He's the current president.
Who's from Virginia Mason, which of course is the wallet biopsy capital of Seattle medicine.
They're about to be bought up by the Catholics.
They have been, I think. Isn't it a done deal?
Yeah. So,
David,
we could
But
try
you
that.
could get the Internal Medicine Society, the pediatricians, the family practice people, and God forbid you general surgeons to all agree on the same thing. That would be that would like move the equator. It would be such a shocking confluence. That I would think that might, if you could get that disparate a group of doctors who hitherto over the last 30 to 40 years never agreed on anything,
Right.
even in our little corner of the world to endorse something, maybe the state would pay a little attention to it, Sherry?
Yeah, the WSMA might pay some attention to that, which could, and they have lobbyists in Olympia whom I know because I've been down there with the, mostly with Healthcare for All Washington, but talking a lot with the lobbyists. And so they know me and they're friendly. They're personally
I'm sorry.
in favor, but that's personal.
David, could I ask, how successful are the sister organizations in the state of Oregon? I had the impression that they were doing very well compared to other states. I'm not up on it now.
I get emails from down there. There's Healthcare for All Oregon, I think, and PNHP is part of that. And, they seem to be fairly active. I don't know what their focus is on regarding healthcare, but I mean, for legislation. But actually, they are the ones who did the survey to find that most people in Oregon would be willing to pay extra in taxes if everyone was covered in the state. Some sort of a poll like that made a whole lot of news. maybe it was just Portland and the adjacent counties to Portland, that Portland residents would be in favor of taxing themselves.
Well, Oregon's a pretty progressive state in a lot of ways. I just heard on the radio today on Tom Hartman that Coos Bay has one of the few rural progressive radio networks in the whole country. And Washington and Oregon have a joint chapter of the American College of Surgery, which I finished being a president a couple of years ago. And there's some pretty progressive rural surgeons in Oregon that amazed me, that kind of came out of the woodwork.
That's interesting.
Yeah. Coos Bay out in, God, where is it? Way out in the, where those guys held off that had that standoff with the Fish and Wildlife guys down in
Malheur,
yeah, the Malheur. I mean, the guy who's the general surgeon in that community is a black guy who's kind of a moderate, but it's an amazing state in terms of progressive politics. They're very pragmatic, but I mean, one of the first places to recycle really seriously, and a whole lot of environmental issues that kind of tie them together. So Oregon is pretty progressive, and we do have a bit of a shared or joint chapter with the Washington state. But I think the thing to take up with the ACP, Sarah and Chris, is to hold their feet to the fire on that 2019 statement they made and say, you guys got to get off the pot or do something, because the pandemic, beyond just the immediate challenges of getting the vaccine out, is proof positive that our national public health system is beyond broken. It is non-existent, and what it was 4 years ago has been deconstructed intentionally by the Trump administration, who were the puppets really of Koch and the libertarians. And Michael Lewis lines this out so well in that book. It's amazing.
Well,
so
I'm going to turn that back at you though, Hugh, because the ACP has come out and made that statement.
Right.
So where are the surgeons? Where, one of the things that I've realized over the last 38 years as an internist is that, unfortunately, families, people in positions of power, legislators, they want to hear from the specialists. They want to hear from the guys and the gals who have the flash, They want to hear from the people who make the big money in medicine.
Exactly.
They don't want to necessarily hear anymore from general internists and family physicians, even pediatricians, though they get a little bit more because little kids always look good in the press. But the truth of the matter is right now, it's the surgical and subspecialty internal medicine pediatrician societies that haven't made a stand.
Yeah. Well, the surgeons, you can't even get them to agree on gun violence because, the flash is cash, and the people still making the best cash in surgery are rural surgeons in places like Idaho and places like that. And those are gun toting. I mean, I had dinner with a Montana head of their trauma, one of their trauma leaders who shot himself in the foot accidentally at the range. And this woman surgeon sitting next to me at dinner was proud of her new pistol she had bought. And the administrator of the hospital bragged about the door prize she won at the charter school of her kids, which was an AR-15. So,
good Lord.
I think for the, I think Sarah's a good point. ACP National has done what only pretty much no other physician organizations have, and actually
We've stepped up.
But I think for local, that's kind of what I'm asking Sherry too. Like,
Yeah.
so Sarah, if you go there and just talk about universal healthcare, they're not going to do anything, or
They're not gonna do
they'll say
anything,
we
but
can make some
I agree with you.
educational
Mhm.
initiative. But if you have a specific ask, like we want Washington State ACP to support Model A and tell whoever, it might be a little late for that one now, but I mean, that's the kind of thing, I think they need something specific to see if they can actually do an endorsement.
That's a good
so
way.
that's-
And I could keep it that simple, Chris.
Yeah.
And then, but then I could say, then I turn it back again to you guys in surgery and in pathology and say, okay. So we ask, or I asked through the ACP Washington chapter health and healthcare policy and ethics subcommittee to ask our new governor, Chris Knight, to endorse the Model A in the new legislation coming up, or in the new proposal coming up to the legislature.
Yeah, or something
It
like
would
that. I
have
think we
so
wait for
much more-
Sherry's guidance here on that. I'm like,
Yeah,
what?
it would have so much more oomph moving forward through 2021 if similar subchapters of the other big organizations, particularly in the specialties, but definitely, of course, in pediatrics and stuff, if they were doing the same.
Well, I'll tell you what I will do. I'm going to wait until the final report of the Universal Healthcare Work Group comes out. And if it actually recommends, and we voted to recommend this, then I will contact the Washington chapter of the AAP and say, how about it, folks?
Should I wait until that comes out, do you think, Sherry?
I think it would be smart because it's what will drive the state effort to be the Saskatchewan of the United States.
Yeah.
I think you all know what I mean when I'm talking about Saskatchewan.
Yeah.
Can you send us a draft, Sherry, of where it stands right now so that we can start working on these people in these leadership positions?
Yes, I can. I'll do it after this. Oh, let's see. It's long. So it'll be an email that has it as an attachment.
Perfect.
I'll send. And David, you've got everybody's email addresses, right?
Everybody here tonight?
Everybody here tonight?
Andre, are you on our blast list?
No, I don't think I am. You can go ahead. Let me just put my email in the chat then. You can add me.
Good.
Okay. So David, would you get his, and so that you have the email addresses for everybody, and I will send it to you and you can send it on. Is that
Okay, that's something we should blast out to the general email or our blast list of 1,000
I wouldn't
people.
at this point. I think it's not exactly confidential, but I wouldn't send it out as a blast to everybody. But I would. We've been requested with our conversation here, so
It's still in draft phase, isn't it?
That's correct.
Yeah, so
Correct.
can't
And
really blast
so
it.
until Friday the 18th, I won't have their final one. Do you want that, or do you want the one that we worked on last week?
Well, I'd like to just look it over and, not publicize it, but we definitely want to publicize the final report. And
Yeah, it's going to be easier actually to do the final report. And part of the reason I say that is that the first drafts came in two pieces. The first was a draft of the first part of the report, and the second part was supposed to be a draft of the second part of the report, but they didn't mesh together all that well, and that was part of the criticism. So to send it to you now, I'd have to send you forward two different emails, of which it would be an attachment. So it's probably better to wait until Friday when they give the final thing, and then have at it. It's not that long, but if you're like me, it'll eat up a lot of paper because I print the damn thing out and take it and sit in a comfortable chair with a pencil and start reading.
That's what I do.
I can't do it.
Yeah, that makes sense to me to wait till for
Sure.
the final.
Yeah,
Right.
and if
What
it,
do you think?
Okay.
For
I
us retired people,
final-
48 hours is a blink of an eye.
send final draft.
yeah, because if they do support Model A, then that's something concrete people can latch onto and endorse, right?
That's what we were hoping. And
Yeah.
I don't know yet what they did. So, but I will send the final draft when I get it on the 18th. I'll send it even before I've read it, so I won't know everything. But I'll send it to David, who can then send it on. Is that okay, David?
Sure.
Okay.
So we should do a little good of the order. Does anybody have anything? Puget Sound Advocates for Retirement Action is going to have a webinar on Medicare Disadvantage, looking at
Oh, that's wonderful.
how terrible the Medicare Advantage is. But that's not until February 8th. But
Oh,
I think,
well, my mailbox has been absolutely full of mail trying to get me to switch to Medicare Advantage.
well, I'd say 80% of mine are to try to help out in Georgia. Send money to Georgia.
Oh, the emails. Oh my God. Delete.
Oh, Sarah, did you mention the book Cast?
I did.
Isn't that
I
a
just
fabulous
finished it. I could hardly put it down. It was gut wrenching.
Yeah,
Sherry, did you read it?
I'm halfway through it.
Well, when you finish it, send it to somebody else, because I sent my copy to Sherry and I want it back eventually. But
Okay.
if anybody else here wants to read it, maybe when Sherry's finished.
It's given me a whole new,
Yeah.
as a mother of a disabled adult, it
grips you on every page.
You realize, where are you in this whole caste system, and what have your life experiences done for your placement in your caste, if anything. I mean, it's just placed so many different viewpoints into what's going on, especially now. But it is can be very hard to read, I think.
It's embedded in all of us from the time we were born, so we don't even realize it half the time. But
yeah, I think I do want to read that Fifth Risk, though. Thank you for reminding me about that, Hugh. My husband and I both love his books, and that's one. Got to the point I couldn't read that Jane Mayer book because it was just like, as a practicing general internist, and just the horrible issues with the private insurance. I just couldn't take any more negative input.
It was interesting in the hardcover edition of that book, on the inside cover, and I've given that book away so many times. There are these incredible diagrams of all of these different 401c corporations that they move their money through. In the paperback, there was no diagrams. I thought, well, it's somewhere in the text, nowhere to be found. I thought, well, it's on the internet, nowhere to be found. So what you want to do is get a hard copy
from the first printing
of the original version, which will go for almost twice the amount of money as they were originally. So if you go to a bookstore or something, you might be able to find it. If you can't find it, send me an email, and I took pictures of those diagrams, because they tell the story so well and so succinctly in a graphic sense.
Is this Fifth Risk that you're talking about?
No, that's Dark Money by Jane Mayer.
Oh, okay.
Hugh, could you show me the cover of that book again? Is that you showed a little while ago? I missed that.
This is, well, it's backwards because of the way the cameras work.
This is the one that's on the bestseller list now, George.
Okay, Cast. Isabel Wilkerson.
George, my 89-year-old mother read it before I did. She was horrified that we hadn't read it yet.
Really? Good for her.
She's a retired public librarian.
Well,
she won a Pulitzer
Might be old news.
for her previous book.
Yeah, I haven't read that one either yet. I wanted The Warmth of Other Suns.
yeah, I have to read that too.
Might be old news, but did you guys see the CBO study? $0.7 trillion would be saved by moving to a single payer system. Recent, what's that? The Congressional Budget Office.
Right.
But one key, they said that's well above what all of our prognosticators have come up with. That is, people on the in the Willander and all of that crowd. It overstates. I mean, it betters that, but it says one of the bigger variables that the previous, like Willander studies and such, is not including the Medicare Advantage element of it, and that increases quite a bit the amount of savings that goes into a single payer by eliminating that program alone. Collapsing it, so to speak.
I had read about the CBO thing, and you're right, it should have been mentioned tonight. So it's now been mentioned, but it is a further sort of non-political affirmation of the fact that single payer would save gobs of money. I think what it was a CBO official evaluation of the Medicare for All bill and what it would do. I think that's what it was. Am I right, David?
I was trying to think. I was thinking of something else. That you wanted me to send you that article about medical students 70% in favor of this.
Yeah,
I see that. Yeah,
that'd be great. I just Googled that CBO deal and I got a blog, but I don't know where that original report is. I'd love to read that too. Oh, okay.
I'll see if I can find it.
I read about it. One of the reasons my books are piling up to read, and the reason I haven't gotten through CAST is because I'm also working myself through Joseph Stiglitz's The Price of Inequality, which is a real slog. But one of the reasons I'm slow at reading is because I get the New York Times and the Seattle Times every day, and I try to read through both of those pretty well, and that takes a fair amount of time. So
that's hardcore.
Yeah, Stiglitz is pretty.
You got to cure yourself of that habit.
I read that Stiglitz book. It came out about 3 years ago.
Yeah, it was in 2012.
Brilliant, but yeah, it's another one. I got done and I'd put it down and then I'd be depressed.
Yeah, that's true. And of course, it's written as we were sort of moving out of the Great Recession, and he refers to that a lot. And it's totally before Trump. Before the pandemic.
It was more than 3 years ago because we were still in Nevada when I read it.
Yeah, I took a look. It came out in 2012, I think.
Yeah, I think my husband, who has a degree in economics, looked at me and goes, "Why do you want to read that? It'll just make you grumpier." I gotta go. It's been a delight, you guys. It's just wonderful to be involved in the chapter.
I thought we had a really nice time to talk tonight, and that would be of just general, like we were on the topic sort of, but it was a general get together, and it's the best that we can do with Zoom. I thought that was really nice.
Could I ask one thing? Could I ask the whole people that are online? Could I ask the whole people that are online there? I get their messages and such, but what is Whole's short, long-term strategy right now?
Yeah, I think I'm the only one left on the call from. Oh, great. So I'm happy to share the floor, but right now I would say that we are investing the most of our effort into a ballot initiative strategy. So we're also trying to work with the legislature. So, it's not that we're putting all our eggs in one basket, but we should be able to start collecting signatures in April. And so right now we are mostly focused on building our organization, doing some initial outreach. so that when it's time to collect signatures, we have a good chance of getting as many as we need. Does anyone else have anything to add to that?
Yeah, just to clarify or to expand on that, the initiative that we are going to be pursuing is an initiative to the legislature, not an initiative to the people. So we have from April through through December to collect signatures, and then of course at that point, then if we get the requisite number of signatures, then the legislature can either adopt it, they can adopt it with and then present an alternate, or I forget exactly, or they can turn it around and submit it to the ballot. So there are forks in the road at that point, but that's not worth worrying about if you don't get the signatures. So it'll be interesting, but it's going to be, as far as I know right now, from what I've read when I've burrowed into the website, the initiative is going to be largely based on the text of what was Senate Bill 5222, and so it represents, as Andre said, a parallel effort to a legislative effort. So that's why we've been, for the last few months, we've done some sign waving, we've been doing phone banking to resurrect people who have expressed interest in whole Washington in the past, to get them get their heads back in the game, to get people to pledge to acquire X number of signatures, which actually we're doing right now. I mean, take it for what it's worth, but we have almost 200,000 pledged for signatures, which is not bad for that. Now, of course, that's not real, but it's at least indicative of some level of interest. And then in addition to that, we've done events to improve visibility. We've shown a couple of films, Power to Heal, which we are going to show this coming Saturday. Or no, is it this Saturday? I forget.
It's this Saturday at 2 Thursday. I dropped a link to it in the chat.
Yeah, I saw that. Thank you. And then the other film event that we had was we broadcast 2 films from the National Film Board of Canada called Bitter Medicine, Parts 1 and 2. And they were documentaries that were produced back in 1982 that described the implementation of healthcare in Canada, starting from the movement in Saskatchewan back in the 50s. And those were exceedingly interesting. So, and proof that attitudes haven't changed a whole lot. So there's a lot going on, but it's all very much in the sort of, coalition building. We're trying to figure out how to best reach out to other organizations to, leverage effort with other, unions and organizations focused on economic and social justice, that sort of thing, so that we aren't, sort of out by ourselves.
You have a big presence on One Payer States, which is a huge network across the country, and everybody in One Payer States knows about whole Washington.
Yep. I have an entire email folder set aside just for One Payer States. God, I mean, it's like I could paper this room with all the stuff I get from them. So yeah.
I have to go, I promised. Thanks,
Okay.
guys. See ya next month. Same, we're having a meeting in January.
The third Wednesday.
Well, we won't be doing it on the third Wednesday. David may not realize it, but the third Wednesday is January 20th. So I think it's probably a poor time for us to hold an evening meeting.
Well, should we do it the next day or the day after that? Or are we going to have to be out in the streets?
Or in the bar. Oh, we can't be in the bars.
Well,
for a
think
coup.
about it and send us out an email. Let's pick a time. The Thursday, the 21st would be okay with me.
I can't. Thursday's the day I have that ACP thing. It's the day after this one.
Right.
But
Well,
I can do it.
We could do it.
That doesn't start till.
We could do it the fourth Wednesday.
That's probably a better guess, because when you start changing the day of the week, you run into things like this.
So that'll be the 27th. So
yeah,
just
Okay.
I'll put out the monthly report in a day or two, and I'll note that we put it off because we need to be out on the streets on the 20th.
We'll
Okay.
be on.
Masks
Oh,
up.
no, we're going to be celebrating. Yay. Yay.
All right. Good night, everybody.
Good night.
Night.
Thanks, everybody.
Night.
We'll do a report back on the Proud Boys.